going to talk about social anxiety disorder. Social anxiety disorder, according to the Diagnostic and Statistical Manual of Mental Disorders 5th edition, encompasses an individual being fearful, anxious, or avoidant regarding social interactions or situations which may involve scrutiny. To be diagnosed with social anxiety disorder, the Diagnostic and Statistical Manual outlines an individual must present with the following symptoms, and the symptoms must not be attributed to other mental disorders, substance use, or underlying medical conditions. Criteria A is an individual must present with having a distinct fear or anxiety about one or more social situations which may involve scrutiny. These situations, for example, could be meeting new individuals or performing whilst being observed. Secondly, criteria B is the individual worries that they will show symptoms of anxiety or that they will act in a way that they will be negatively viewed by others. They worry they may be humiliated, embarrassed, or rejected in these social situations. After criteria A and B, there is criteria C to G. So just a few of these are that the social situation will always bring on fear and anxiety, that the fear and anxieties are present for 6 months or more, and that the fear and anxieties create clinically significant distress in one or more important area of functioning. The last 3 criteria outlined in the Diagnostic and Statistical Manual to diagnose social anxiety disorder relate to the attributing factors as discussed previously. So social anxiety disorder is not better explained by substance abuse, such as drug abuse, or not better explained by mental disorder, such as panic disorder, or another medical condition, such as Parkinson's disease. Next is the etiology of social anxiety disorder. So the onset of social anxiety disorder generally begins in the life period of early to middle adolescence, although social anxiety disorder might present itself in younger children. The prevalence of social anxiety disorder is generally found to increase from childhood through to adolescence, and it tends to have a chronic course and will not improve without treatment. Review of the literature has indicated the onset of social anxiety disorder may be influenced by a range of biological, psychological, and environmental factors. For example, genetics playing a role in the hereditability of social anxiety disorder, temperamental traits, behavioural inhibition, which relates to behaviours tending to show such as fear, avoidance, or withdrawal when new situations or objects are present, and parental influence, parents modelling behaviours of apprehension of social situations, leading to less positive social interactions, and then the children modelling these in their day-to-day life. These are just a few of the many factors influencing the course and cause of social anxiety disorder, and whilst I briefly touched on them, it is critical to look at an individual's whole situation through the biopsychosocial lens, which will help gain a better understanding of the personal situation of the presenting client, which will allow for personalised treatment with the aim of the best possible outcome for each individual. In order to do this, we look at assessment tools, treatment, and treatment outcome measures. There have been many tools developed to assist professionals in assessment of social anxiety disorder, from self-report measures to clinically administered structured interviews. I'll touch on a few. The first being the Social Phobia Inventory Screening for Social Anxiety Disorder. So this is a 17-item self-report scale, and it has been found to be useful in distinguishing between individuals with social anxiety disorder and the non-clinical population. Questions on the social phobia inventory include items such as fear of embarrassment causes me to avoid things or speaking to people, and being embarrassed or looking stupid are among my worst fears. The social phobia inventory uses a 5-point Likert scale, where 0 means the individual is not at all likely to have been bothered by the symptom in the past week, and 4 being extremely likely to have been bothered by the symptom in the past week. It has been presented that the cutoff score is 19 to distinguish between individuals who present with social anxiety disorder and those who don't. The social phobia inventory is designed to measure 3 symptom dimensions, one being fear, the next being avoidance, and the last being physiological arousal. The next tool for assessment is the mini social phobia inventory. So the mini social phobia inventory is based on the 17-item social phobia inventory, and it comprises 3 items derived from the social phobia inventory that produce the greatest statistically significant difference between those who present with social anxiety disorder and the non-clinical population. With its quick administration times and the ability to differentiate between clinical and non-clinical populations, the mini social phobia inventory is a great tool for initial screening of social anxiety disorder. The cutoff score differentiating between those presenting with social anxiety disorder is a score of 6. An example question of the mini social phobia inventory is, I avoid activities in which I am the center of attention. The last assessment tool I will discuss today is the 45-item self-report social phobia and anxiety inventory. The social phobia and anxiety inventory was developed on an empirical basis to assess social phobia in particular, specific somatic symptoms, cognitions, and behaviours across a range of potentially anxiety or fear-producing situations. The social phobia and anxiety inventory has been shown to discriminate between socially anxious and non-socially anxious participants, and between participants with social phobia and those with panic disorder. The items on the social phobia and anxiety inventory are rated on a 7-point Likert scale. Some example questions are, I experience troubling thoughts when I'm in a social setting, and I experience sweating in a social situation. The time to complete the social phobia and anxiety inventory is between 15 to 20 minutes. So there has also been shorter versions created of the social phobia inventory, such as the social phobia and anxiety inventory 23 and the version for children. Now to treatments. The main treatments used for social anxiety disorder include psychosocial treatments and pharmacological treatments. Psychosocial treatments have had much focus placed on cognitive behavioural therapy. Within cognitive behavioural therapy, there are treatments which are comprised of various combinations of exposure therapy, cognitive restructuring, applied relaxation training, and social skills training. Exposure therapy involves individuals affected by social anxiety disorder being continuously exposed to situations. This could be virtually imagined or in real life until the anxiety in those situations decreases. Social skills training relates to an individual developing through exercises such as modelling and rehearsal or social feedback, the skills that are necessary to have positive social interactions. There are a few cognitive behavioural intervention programs which incorporate a variety of the cognitive behavioural therapy treatments, one being group cognitive behavioural therapy and the other being social effectiveness therapy. Both intervention programs focus on group interactions with a mixture of the cognitive behavioural therapy components over a period of time or sessions to help reduce the impact social anxiety disorder places on individuals. A few other forms of treatment include acceptance and commitment therapy and mindfulness that can be implemented to treat social anxiety disorder. Finally, another empirically based treatment is the pharmacological types. The most common pharmaceutical administered to treat social anxiety disorder are selective serotonin reuptake inhibitors. However, selective serotonin reuptake inhibitors produce side effects such as fatigue, sleep issues, or agitation. Again, as individuals are always different in their needs, choosing the option most suitable for their situation is imperative. Once treatment has occurred, it is highly beneficial to measure the outcomes of the said treatment when dealing with social anxiety disorder. As discussed previously, there are many self-rating scales to help diagnose with the measurement of social anxiety disorder. The use of these tools before implementing treatment as an intervention not only provides a strong basis to develop hypotheses and diagnoses of social anxiety disorder, but also doubles up as they provide a baseline measure to further follow up during and after treatment interventions. The baseline measure using the assessment tools allows us practitioners to read-administer the assessments and compare results at varying times throughout the treatment and following the completion of treatment to see if improvement has been made and if the treatment is therapeutic. Using the social phobia inventory, the 17-item pre- and post-treatments appears to be a sensitive measure of treatment outcome following cognitive behavioural therapy. Studies such as Antoni and colleagues conducted in 2006 provide evidence of this, that the solid effect sizes between the pre-treatment and post-treatment social phobia inventory scores, it is evident that the social phobia inventory works well as a treatment outcome measure. Review of the literature also presents that the social phobia and anxiety inventory and the children's version of the social phobia and anxiety inventory are both reliable and sensitive measures to determine treatment outcomes for social anxiety disorder. Tolbar and Associates in 2012 present the social phobia and anxiety inventory for children, captures the changes after intervention in the presentation of social anxiety disorder in children. In other similar studies, these findings have been replicated. So in conclusion, I hope I have provided you today with a brief outline of the symptoms, etiology, tools of assessment, treatment options, and treatment outcome measurements for social anxiety disorder. It has been my pleasure talking with you today, and I wish you a great night. Thank you.